my dear viewers, once again welcome to my IT channel. Today we will see another one case discussion. This letter is directed to an occupational therapist and the patient name is Mr. Joy Black and the diagnosis is permanent paraplegia. So let us see the writing task. So I have to tell you as same like before, every time when you will start, go to the writing task first, read the writing task, get an idea regarding the reader to whom you are writing, the first one, and whether it is a known case or unknown case, and the next one, what is the requirement, and sometime you will get the condition. I mean, what is the reason, present medical condition also, but sometime, not all the time. These all are the content. First, you have to get it from your writing task. That is the task which is given at the end of your question paper. So let us read that point. So, in this letter, the writing task is you are the nurse in charge of the rehabilitation ward at Pindara Private Hospital. Using the information provided, write a referral letter to Annie Mary Johnson, the occupational therapist in charge for rehabilitation patients in Pindara Private Hospital, 1182 Bermuda Street, Southport, QLD 4220, requesting assessment of Joy's disability level as well as necessary aids, support, and therapy in order to help him to adapt and regain independency to live a life as close as possible to normal. So, this is the writing task, and many things you can get it from this writing task. You can see what all the things I have marked with the red ink. This is a referral letter, and of course, this is not a known case. And the patient is admitted in the hospital, Pindara Private Hospital, and this occupational therapist is from the same hospital, but it's not a known case. You should not think in that way. And address is given, and requirement also is given. That is requesting assessment of Joy's disability level. So the first requirement is assessment. Then the second one is necessary aids and support. So now itself you got the requirement, that is the assessment of his disability and provide aids and support for his rehabilitative services. So this much things you will get it from the writing task. So we will see from the starting. You are the nurse in charge of the rehabilitation ward at Pindara's hospital. Joy Black, this is a patient name, Joy Black, has been transferred to your ward from the Gold Coast University Hospital. So you got one patient who is referred from another one hospital. Patient name is Mr. Joy Black. Date of birth is 1 May 1990. Discharge date planned is 15/5/2015. Medical history is, it is past medical history. Patient had fracture of the wrist 7 years old when he was 7 years old. Then anaphylactic allergy to penicillin and N10. So when you are reading the task, I mean the notes, you have to underline when you are practicing, even in the home. When you are practicing, please follow this practice. That means you have to underline and you have to make relevant notes. It will be helpful for your letter writing. So here patient name, date of birth, discharge date, and this allergy. These are all the things are important in this section. Social history has been given. He lives with the parents and younger sister who is 15 years old. Full-time tertiary student, third year Bachelor of Law at Queensland University Hospital of Technology. And the family lives in two-story on a very steep hill, and there are 5 steps at front of entrance. Motorbike used to be his daily transport to university and other social activities. Other hobbies are riding his horse and surfing weekly. Dirt bike ride occasionally. So here we need to know regarding the social history. He is a full-time tertiary student. That's enough. And lives with parents and the family. How we need to mention regarding the house, because we are going to write letter to an occupational therapist, and I hope everybody knows the difference between physiotherapist and occupational therapist. If you don't know, I will just tell you. Physiotherapist means he will give or provide assistance in exercise programs, and the mobility, range of motion, everything. But occupational therapist means he is the one who will assess the disability of the patient and will modify his or her home, which will suitable for the patient's rehabilitation. Because mostly after a traffic accident, or if there is any paraplegia or hemiplegia or something like that, mostly the patient will be in a rehabilitation. and period, and maybe he will have a walker, wheelchair, or in the home itself there should be side rails, the commode, the showering area, side rails, these everything. And of course the house should be suitable for the usage of a walker or a wheelchair. So these all are the duties of the occupational therapist. So according to that, you have to write the letter, because you should not make confusion, because in such case not you will get many ideas which will be common for community health nurse, occupational therapist, and physiotherapist. So you will get confusion when you are writing the case note. But when you are reading at that time, always keep it in your mind who is the reader and underline. This is what I mentioned in an earlier period. You have to underline, but you have to think about to whom you are writing, because here family live in two-story on a fairly steep hill, and there are 5 steps of front of entrance. For community health nurse or physiotherapist, no need to write this sentence. It is for occupational therapist, so you have to mention regarding the home atmosphere. I hope it's clear for you. We will move to the next. Current admission 10 March 2017, brought by ambulance in emergency department called Coast University Hospital following a motorbike accident on the highway on his way back home from university. And they did X-ray and CT. In that, it is revealed multiple fractures to upper and lower limb. More than that, I mean, in addition, there is injury in the left hip, ribs, everywhere. And right arm placed in fiberglass. Actually, this is cast. There is a spelling mistake. Fiberglass cast. And injury to spinal cord, thoracic vertebrae. I mean, in the one. So we can underline. This is a scenario. We are going to make a story. So always keep it in a mind. In this present medical paragraph, that means the second paragraph, you have to make a story. That means from the time of admission until now, when you are writing the letter, what all the things has happened for the patient. So it should be like a how you are writing the case, not during your duty time when you are handling a patient, how you are giving the handover to the next staff. That same way, in that same way, we can write, but you have to write it in like a passive voice, because when you are writing the case not in your patient file, it will be like a active voice what you have given. I mean, it's like the importance is for you, not for the patient. I have given, I have administered, and this everything it will be like in a active. But in this official OET letter, you have to give importance for the patient. That means he was admitted, he was like he has undergone, or he was commenced on. That means you are giving importance for the patient. You have to start with he or she, like that. So in this sentences, you should underline following a motorbike accident, and the diagnostic evaluations, X-ray and CT, and in that what you find out multiple fractures and wherever. So these all things you have to underline. For which he underwent emergency surgical treatment, total hip replacement surgery. Okay, THR means total hip replacement for his hip and surgical spinal intervention in order to stabilize the injury. And he diagnosed with permanent paraplegia due to nerve damage in thoracic vertebrae. So that is his diagnosis, his confirmed diagnosis. This is the thing what you are going to write it in the introduction paragraph as a recent present medical condition. Then 11 March 2017, patient was transferred to orthopedic surgical ward for further investigation, postoperative treatment and recovery. Then permanent suprapubic catheter inserted due to loss of bladder muscle control due to spinal injury. 15/4/2017, he transferred to Pindara Private Hospital for further rehabilitation therapy. So you are working in this hospital, so you got the patient in 15/4/2017. But all this past history need to write it in our present medical paragraph, or else there will not be a story. So you have to start from the beginning of his road traffic accident. So here we saw total hip replacement surgery and surgical spinal interventions has done, and they diagnosed as permanent paraplegia due to the nerve damage in thoracic vertebrae. He's in rehabilitative therapy, and so that they inserted permanent suprapubic catheter. That's all. Here we should know. Gradually, physiotherapy rehabilitation has started for regaining muscle strength, learning to cope with his new restricted mobility condition and avoiding lower limb muscle dystrophy. 1/5/2017, he started to mobilize using wheelchair, regained full strength and utility of arms and upper body muscles, but patient worried to return home due to home settings. Discuss the help of occupational therapist. So you just remember OT means occupational therapist, because in some case note you can see only OT. It will not be the letter for occupational therapist, but as a recommendation paragraph, as in the recommendation paragraph, there will be like discharge plan, there will be like a recommendation referred to a OT. So please don't get confused. OT means occupational therapist. For further rehabilitation and assessment, discharge plan is OT referral for patient disability assessment and further rehabilitation to help him regain as much as independency as possible with daily living activities. Ensure he has necessary aids to provide support with the mobility and activities of daily living. So here, gradually they have started the physiotherapy as a rehabilitation. He started with mobilizing with a wheelchair for regain full strength and utility of arms and upper body muscles. But he is worried because his house modification need to be done with the help of an occupational therapist because he is using wheelchair. That's why you are going to write a letter to a occupational therapist. That means she is in charge. For what you are writing, it is for the patient disability assessment. Same like what you have seen in this, I mean, writing task, same thing. Patient disability assessment and for further rehabilitation. These two things are the one, the requirement. As much as independence as possible with the daily living activities. Ensure he has necessary aids to provide support with the mobility and daily living activities, so which include home modifications also. So that house assessment should be modification. What are the modification the occupational therapist has to do? Modification to be suitable for wheelchair, such as ramp over stairs, double door modifications made to the bathroom, toilet disability rails, commode showering chair. So these are the modifications he has to do in his home. And another one more requirement, I mean the recommendation, daily home visits for the first 2 weeks to teach and support him to adapt to the new modification made. So these are the main two recommendations what you have to write it in the recommendation paragraph. Home assessment plus daily home visit for the first 2 weeks. Just you have to check and support and teach him how to adopt with the new modification made, because it is new for him with these all new modifications. Then you can see that in the discharge plan you can see many recommendations, but keep it in your mind, you are going to write the letter to an occupational therapist. So here, regular physiotherapy section to avoid muscle dystrophy in the lower limb, regular GP's appointments to check the suprapubic catheter. These two is irrelevant to occupational therapy, so we have to exclude this point. That's why I just marked in a red box only for the recommendations for occupational therapy. So always keep it in your mind, according to the reader only you have to select your recommendation, your recommendation points. So once again, I will read for you the writing task. You are the nurse in charge of the rehabilitation ward at Pindara Private Hospital. Using the information provided, write a letter of referral to Annie Mary Johnson, the occupational therapist in charge for rehabilitation. Patients in Pindara Private Hospital, 1182 Bermuda Street, Southport, QLD 4220, requesting assessment of Joy's disability level as well as necessary aid, support, and therapy in order to help him to adapt and regain independency to live a life as close as possible to normal. Anyway, we have only two recommendations, that is Joy's disability assessment and home modifications along with aids and support. So fine, I hope the case note is clear for you. Let us see how we can write this letter in OET format. So we will start with the date and address, 1 May 2017. Miss Annie Mary Johnson, occupational therapist in charge, Pindara Private Hospital, 1182 Bermuda Street, Southport, QLD 4220. So just we will copy and write from the writing task. Salutation is Dear Miss Johnson. So you will take only the surname of the reader, and here actually the designation not the salutation is not given Miss or Mrs, but you can write Miss. If it's not given, you can write Miss. Regarding patient name, Mr. Joy Black, here you have to write patient's full name, date of birth 1 May 1990. Just keep it in your mind, the format of date, it should be same like this, no bar, no comma, nothing. We will go to the purpose paragraph, that is introduction paragraph. Just we should write three things. First, we have to introduce the name of the patient, complete name, and the recent present medical condition, as well as the requirement. I am writing to refer Mr. Joy Black, who is diagnosed with the permanent paraplegia. He requires disability assessment and further rehabilitative assistance to regain his independence. He is said to be discharged on 15 May 2017. So here we are introducing the patient's name, Mr. Joy Black, and the recent present medical condition is he is diagnosed with permanent paraplegia, and he requires the requirement is disability assessment and further rehabilitative assistance to regain his independence. And here actually they have given the discharge date, planning for discharge on 15 May 2017. That's all the introduction paragraph. And another one more thing, here there is a correlation in there should be a correlation in your letter. That means what you have written here, the recent present medical condition, it has to be explained in the next paragraph. And what is your requirement written here, it has to be explained in your last recommendation paragraph. That means your next paragraph should be the expansion of this permanent paraplegia and how you have managed until now, and the last paragraph should be the expansion of what all the requirement you needed in detail. So, the present medical history paragraph, Mr. Black was admitted to Gold Coast University Hospital on 10 March 2017 following a motorbike accident. His radiological investigations revealed multiple fractures in the left hip, ribs, upper and lower limbs, as well as injury to spinal cord, thoracic vertebrae 1 to 8. Thus, he underwent total hip replacement surgery and surgical spinal interventions. In addition, his right arm was placed in a finger glass cast. So you are writing the letter to the occupational therapist. So all relevant data have to be regarding his mobility. I mean, after the accident, what are the things it's happened and what are the management we did, and what all the physiotherapy it's going on, and currently what is his condition, what is the thing you need. That is the content of your present medical history paragraph. So here we just start with the Gold Coast University Hospital because he was admitted in another one hospital. Later on he shifted to our hospital. So Mr. Black was admitted to Gold Coast University Hospital on 10 March 2017. So it's following a motorbike accident. And the next step, we will write regarding the investigation. So he underwent some diagnostic evaluations, and in that which revealed multiple fractures. So I can write wherever the fractures are present in the left hip, rib, upper and lower limbs, as well as there was a injury to the spinal cord, thoracic vertebrae 1 to 8. So what is the management we did? He underwent total hip rib. Here you can write he underwent or he has undergone. Both it's correct. He underwent taught, because if it is very near, very recently means you can write he has undergone, but if it is more than 1 month or 2 months means simply we can write it in past tense, he underwent total hip replacement surgery and surgical spinal interventions. In addition, his right arm was placed in a fiberglass cast. So this is the, we can split the paragraph. I mean, only the present medical history paragraph can be two, not other any paragraph. So if it is big content, if you want to write a big content in this medical paragraph, you can split. Here we can write every management in here in this paragraph, and the next paragraph we can write about the physiotherapy section. So and the requirements. I mean the short conclusion for the requirement. So it will be it will look like a good presentation. In the next paragraph, we can continue with the present medical history. That means gradually Mr. Black was transferred to our hospital, because until then the surgery, everything, it happened in another one university hospital. Later on for the rehabilitation and for the especially for the physiotherapy, they have referred this patient to our hospital. Why I am writing our hospital means this occupational therapist also working in this same hospital. So gradually Mr. Black was transferred. Uh, See the I mean the spelling, TRANSFERRED, to our hospital and was commenced on physiotherapy and started to mobilize with a wheelchair. So always with a wheelchair. Okay, don't write wheelchair, simply a wheelchair. Subsequently, you can write many connectives like gradually, subsequently, this again, currently. So these everything it will help you to make the sentences like in good presentation. So subsequently, comma, he has regained full strength and utility in his arms and upper body muscles. Then everything is gone. Continued physiotherapy for a long time. No need to write many stories here. Then we can conclude currently what is the condition of the patient. So currently he is ready for discharge, but his house setting is not suitable for his rehabilitation. So this is the thing it's stated in our question paper, that is a patient concerned about the home condition because it's not suitable for the use of a wheelchair. So here just simply we can write he is ready for discharge, but his house condition is setting is not suitable for his rehabilitation, for which your expert assessment and home modifications are essential. So this is simply but neatly we are concluding the paragraph, and the reader also will get a clear idea. That means the patient is ready for discharge, but they are waiting only for us to make the home suitable for him. That's why we are just concluding, but his house hunting is not suitable for his rehabilitation, for which your expert assessment and home modifications are essential. So that's all the present medical history paragraph. Next, we will go to the social history paragraph. Mr. Black is a full-time tertiary student who lives with his parents. His house is two-storied on a very steep hill and contains 5 steps at in front of entrance. His hobbies are horse riding and surfing. So here nothing to be write more, but you have to give importance for the house explanation. That is the important thing. So just we can write he is a student and lives with his parents. And regarding the house, it's a two-storied on a very steep hill and contains 5 steps in front of the entrance, because we just have to give a like it's not a clear idea, but even just a small idea about his home. His hobbies are horse riding and surfing. We will see the recommendation paragraph, that is the last paragraph. Kindly assess Mr. Black's disability level as well as provide necessary aids and assistance to adopt and regain his independency to live his rehabilitative life with a minimal assistance. Please assess his house and provide modifications to be suitable for a wheelchair, such as ramps over stairs, double door modifications to the bathroom, toilet disability rails, and a commode showering chair. It would be appreciated if you could visit him daily for 2 weeks to teach and support him to adapt to the new modification. This is nothing but I have taken that two important points from the recommendations, I mean, for the requirement part. So just we can just make a connection with this kindly and please. It would be appreciated if you could. That's only the connectives just I have added. So what we are telling here, we are just requesting him to assess his disability level to provide the necessary aid and assistance to adapt to living his rehabilitative life with a minimal assistance as much as possible. Without assistance, how he can live his rehabilitative life furthermore. So kindly assess Mr. Black disability level as well as provide necessary aid and assistance to, simply we can write assistance to adapt to living his rehabilitative life with a minimal assistance. Then he has to assess his house first, then to make some modifications such as which should be suitable for the use of a wheelchair, such as ramps over the stair and double door modifications to the bathroom, then toilet disability rails and a commode showering chair. These and all assistive devices and modifications of the house for the disability, the person with a disability. So, and another one more requirement, I mean, the request is that he has to visit him daily for 2 weeks, just to analyze how he is coping with the situation, and if there is again if he need assistive services and support, he can give at that time. So this much regarding the recommendation paragraph. So the conclusion paragraph will be, if you have any queries, please do contact me. So this is common for every letters, and this paragraph will not be they will not count for your letter counts, and they will not assess for your letter counts. This is like additional paragraph. Then yours sincerely, registered nurse. So here the already the reader's name is given, so you can write sincerely. Should be small letter completely, and registered nurse. That's all. The letter body paragraph. I hope this letter is clear for you. So somewhat, sometimes it will be complicated because it is to the occupational therapist and it is out of our scope of service. Even though Just you can write in the present medical paragraph a slice of story from the starting until now when you are writing the letter, what all things has happened and currently what is the situation for the patient, and the recommendation, everything which will be given in the case note, but you have to abstract only for the occupational therapist. So for that you have to know about the scope of service for all non-medical, even medical and non-medical professionals. So it will be easy for you. So try to organize the letter according to the priority and write your letter body paragraph as well as the recommendation paragraph. Okay, thank you for watching. We will see with another one informative letter. Until then, take care.